We see our clinical informaticists as a crucial partner in delivering technology solutions to the care settings.
Kind of a gray area between the IT side and clinical informatics, where we are the clinical experts in defining how the staff should be using that technology.
Thank you for joining this episode of the Elephant in Your Hospital podcast with Futura Healthcare. I'm Jessica Ballash, Director of Marketing at Futura, and today I'm joined by industry healthcare leaders Valere Lemon, Division Director of Clinical Informatics, and Wesley Jayroe, Director of Enterprise Applications, as well as Cyndi Cahill, who has over 30 years healthcare experience wearing multiple hats, including former CIO and former CHIME board member. In today's discussion, we talk about the integration between IT and clinical informatics. Wanted to just get your opinion, and I know, Val, I actually listened to a previous podcast that you did recently where you reminded all of us that clinical informatics itself it's actually pretty new, even though sometimes it seems like it's always been around. So we understand that there's differences amongst health systems, probably within your own organization. But how does your organization define clinical informatics?
Our organization looks mostly at workflows and optimizing those workflows, such as order sets, nursing flow sheets, nursing documentation, all the ancillary staff, pharmacy, lab, all of the way that they use our electronic health record technologies. And then in addition, we're responsible for all the other technologies that our staff use. It's kind of a gray area between the IT side and clinical informatics, where we are the clinical experts in defining how the staff should be using that technology, such as a phone that they're using to communicate with other staff. But we're not the ones that are installing the hardware, if that makes sense.
Okay. All right. And then Wes, I know from you being on the enterprise application side of things, how does your organization work with the clinical informatics team?
Yeah, so I've been with my current organization for about 7 years, and clinical informatics, I want to say, started about 5 years ago within our organization. And as you can imagine, we're constantly evaluating our approach and trying to make improvements to how we utilize clinical informatics within our organization. And yeah, we do report in different reporting structures. I'm in our information services area, and then our clinical informatics partners through our CMIO. And so we're currently in the process of changing the way we think and work in a more agile type way. And so as part of that, how do we integrate with our clinical informatics group to help make sure that they're adopting the technology that we're delivering. Mm-hmm. And so we see our clinical informaticists as a crucial partner in delivering technology solutions to the care settings. They assist with project assessments prior to IS resources taking over the execution of the project. And we're also partnering with them with a program that's called Physician Builder. And it's where they can actually get certifications. The actual doctors in our hospitals can get certifications in the application and partner with IS and clinical informatics to actually build out the application and smart sets and things that make their jobs easier. And class research has provided some really good data on improving that provider satisfaction, because we all know that provider burnout in our industry is huge. And so that's something we're working with clinical informatics on the daily to try to improve.
Val, I'm interested how you guys prioritize what reports or what applications get installed.
Go ahead.
Oh, sorry. We prioritize basically based on need initially. If there's been a safety event, obviously that's related to some kind of technology or workflow within our EHR, we would prioritize that. But we really look at kind of three things: safety, quality, and revenue. And so looking at how is this going to help us improve the safety of care, the quality of care, and then is it going to help us save money, or is it going to optimize so that we could actually not make money off of it, but generate more revenue by streamlining workflows and things. So A lot of it comes from our corporate structure. We have our own liberties within our division, but a lot of it goes back up through our corporate structure and our corporate clinical informatics team that has already piloted it in one site and identified that it was a good tool to use. And so then we might operationalize, or we might be the ones piloting it. So that's there's multiple ways that we attack that, but that's a little bit of how we do it.
Great. And how about at a smaller organization, Wes?
Can you repeat the question?
Sure. Just wondering how you prioritize what actually gets done, what reporting or what applications get chosen.
Well, we have as new technology requests come in, we have a business planning group that takes that request, works with the customer, and then we will, if it requires a vendor selection, it kind of goes into a different process flow where we reach out to different vendors and get demos, and we do an evaluation to make sure it aligns with all of our enterprise integration strategies from the different technologies, and making sure that we're not bringing in new tools that overlap with other tools. And then from that point, if it does involve clinical informatics, they will do an assessment of that. And then we actually go through a portfolio review, and we estimate hours. And that's kind of how we're managing the portfolio and the ask that are coming to clinical informatics and information services.
Interesting. Thanks.
Okay. So what are some of the challenges that might arise between IT and clinical informatics when it comes to things like implementing new technologies or end user requests, like we were alluding to just now? Val, if you'd like to go.
Sure. I think the biggest thing is defining who's on first. With big projects, it's hard to define who's the person that's actually leading the project. And so we have, as Wes said, it's very important to partner with we have ours is called IT and S, but partnering with them and ensuring that we know that the clinical informatics team is helping to define the workflow. But as far as who's doing education, who's going to be actually ordering supplies, going through basically the whole project management step, identifying who the responsible parties are, that's really the biggest thing, is just figuring it out. And I would say that's the biggest lead to your success, and also the biggest challenge, because every facility has different ways, even though our corporate structure has a different way of how they manage that, and different personalities mix differently. So you have to kind of figure out how to well define your scope. And we've been working on that recently. We've identified a gap in identifying the scope of who's responsible if we have a new technology that's being implemented. What is a clinical informatics team's role? What is the role of IT and S? So that we have that as a starting off point, but then also being agile and working through that and learning along the way. I think that's been the biggest thing for us, is being able to say respectfully, hey, this is really something that I don't have in my scope, because I don't know the technology. I don't know how to do hardware. I don't know how to install a device. So that has to be IT. But if a user has a question on how do I use this, or when is the appropriate time to use this, then that's when they rope in the clinical informatics team. So I think having a good partnership and then communicating that well to your stakeholders and the end users along the way.
Thanks. Wes, how about you?
Yeah, I would say one of the biggest challenges is alignment of priorities. Clinical informatics, and I think that happens across a lot of different groups within our corporate services division, is, what's a priority for us, because we don't work on all of the same projects, might not be a priority for the clinical informatics team in the same way, or, our analytics group, or it could be anyone. So I think that's one of the things we're really trying to solve for with kind of what we're calling funneling all of the requests that are coming in through emails and everything into one place so that there's visibility across the enterprise as to what's being requested of what resources. And then they can, we're kind of standing up a committee that will, our governance group that's going to review those and make sure they align and they have value to the organization as a whole.
So for you both, do you have a PMO or project management office that is involved in all of the projects that you guys run? And does that PMO work for IT or governance or some other piece of your organization?
We do. They do not report to IT or clinical informatics. They're a separate office and they're assigned to different projects. I would say we consistently have the same project managers, thankfully, because they kind of know how we all operate and the things that we're going to want out of them just to help us be successful. But yeah, and sometimes we'll have two project managers if it's related to the technology side and then just the operational of getting all of the, something like a new tower being built in a hospital. You need multiple people involved in that, managing that project. So sometimes we'll have multiple that are kind of working on different chunks of, like, one person's looking at the whole picture and another person's managing the EHR implementation, for example.
Got it.
Yeah, we're similar. We have a PMO office, kind of rebranding it. It was our enterprise transformation office. Now it's a business planning. That's really the funnel to all of the corporate services arm of the enterprise. And we're trying to do a better job of vetting the projects as they come through. Right now, there's a large portion of them that if they don't involve a large or multi-team effort or over a certain threshold of hours of resource time, then we will actually take that on, and the managers within our IT department will actually run those projects as a manager-led.
Well, we're coming up on time here, so if there's nothing else that either of you wanted to add, I wanted to thank you both for taking the time to spend with us and share your experiences. You both are doing great work for your organization, so I appreciate it. And we look forward to future conversations with you, but definitely appreciate your time.
Thank you so much, Cyndi.
Thank you.
All right. Thank you all. Thank you for listening to today's episode. Be sure to subscribe to listen to future episodes of the Elephant in Your Hospital podcast, or visit our website at futuraworks.com/podcast.